turn it over to Kate so she can introduce our speaker.
Thank you so much, Kim, and welcome everybody today. My name is Kate Stenyam. I'm also with the National Rural Health Resource Center, and I just want to do a brief introduction of Pat. I'm sure almost all of you already know her, but she is the Executive Director of the Illinois Critical Access Hospital Network, and the Illinois Critical Access Hospital Network has 53 small rural Illinois hospitals dedicated, and it's dedicated to strengthening the operations of its member hospitals through collaboration. Those of us who know Pat know she's never opposed to anything new and different, and always makes certain that change, that the change to be effective will also be connected to resources available. So we're thrilled to have her on today. I know, just to give all of you a little bit of background, we chose this topic and what Pat's going to be presenting today because of the feedback that we've received from the assessment through feedback from the SHIP coordinators and state office directors, as well as feedback that we've received from the Federal Office of Rural Health Policy, that states really want to have some best practice resources and tools that they can modify and take and use within their own states. So I know Pat's been really put a lot of time and effort into the presentation that she has for you today to share a lot of the best practice tools and resources that ICANN uses in terms of networking. So with no further ado, I will turn things over to Pat to get started.
Good afternoon, everybody, and thanks, Kate, for the nice introduction. It's always a pleasure to work with my friends across the country here. I looked at the list up here, and many of you I've known over the years, and you could be doing the webinar for me. But anyway, I'm the lucky one to do it today, and I appreciate being able to share some experiences and some of the tools that we've used. And I've been working with SHIP for a number of years, really since it started, so maybe some of that background will be helpful to you. Kate, I don't know, can I advance the slides? You know, with that, it looks a little, are you going to advance them for me?
No, you should have access to, there's little arrows, right, at the bottom.
Okay.
Yep.
Oh, that is it? No? Nope. Oh, here it is. Here we go. There we go. Okay. Just sometimes technical support here, you know, for me, have to get that right here. So thanks, everybody, for your patience. Anyway, like I said, I've looked over the list of people from the various states, and it's really going to be interesting conversation I hope we have as we discuss some of the SHIP options. And thank you for being on today. What I wanted to do today was cover briefly, you know, what we've discussed at the last session, and talk a little bit about hospital needs, how you determine, give you some examples in collaboration. We know that's upcoming with the SHIP program. So without further ado, let me move into the actual discussion part. Anyways, we know SHIP program, as I talked last time, has been around since really 2002. It certainly has evolved over the years, and we sent recently, even yesterday, I think Christine Martinson sent out an indication of what the new competitive SHIP grant will be like. And so I think that's important to keep in mind as you look at your SHIP program and some of the things that I discussed today. Why are we moving into these directions? Why talk about consortiums and things like that? And that's partly because the SHIP program continues to evolve. Really want to talk about identifying needs, and I know many of you have been doing this for a number of years, and I hope you chime in and share your ideas and resources. Some of you are new, and that's really what Kate was getting at, is people that they're somewhat new to the process, would really like that information. Framework, we talked about how to put a consortium, and I'll give you some examples, and really talk about engagement. How do we get the hospitals involved and moving forward? And I think that's really important. That's why we're here, and that's why you're spending this next hour with me, is how can we really reach out to our hospitals, make this a valuable program to do, because we know it's important for the rural infrastructure in our rural hospitals. And it's a wonderful program available to our hospitals, and we want them to take advantage of it. And that's really our role. Our role is to reach out to them. And so I look forward to hearing your suggestions too as we get into that discussion. I wanted to emphasize that when you look at the new competitive guidance, and we're going to know a lot more September 21st, and really know a lot more when we finish the project in December, because there's obviously a new guidance, and it'll be 4 years now, and I know there's a webinar coming up very shortly that will go into more details. But I put this up because I wanted you to think about this, and as we have our discussion, noticing that obviously critical access and small rural hospitals under 49 beds, is still the eligible hospital group, and they can use their SHIP funds for provider-based clinics. We've kind of allowed that over the years, but there's more and more emphasis, I think, in Illinois. The average critical access hospital in Illinois has 3 rural health clinics. Some have 11, and some only have 1, but it's that growing area that they're really responsible. They become their own little mini system within the rural community, and they've had to do that to preserve their resources. So, our grant programs need to evolve to match those. We also know that they've put together a special innovation project to encourage collaboration, networking, and sharing of resources. We don't have enough, and so if we can pull those resources together, often we can tackle bigger projects, and then we can engage projects over a longer period of time. So it'll be interesting to see how the guidance actually handles that, and I'm looking forward to using the new program, because I think there's some pilot programs that we've wanted to do over the years and haven't done it, because we've looked at SHIP as 1 year in and 1 year out kind of thing, and we can see that the program is moving more towards what Flex looks like. How the programs really are to expand and over the course of the grant cycle. So let's talk a little bit about identifying the needs of the process. And we're going to look at that application very shortly. You really have got to get hospital feedback. You can't, several years ago we could just send the information out. The hospitals could just check their box and say, we'll use the money for medication reconciliation or quality improvement or a new revenue cycle management program, and most of the hospitals took the money. Well, you see the grants intents are changing, and so they're really looking for us to really help the hospitals identify what's important for them. And so, we're going to have to take more effort. We're going to have to put more effort into this identification process and needs assessment. We've had to do that with ICANN over the years. And so there's different ways of going at it. I'm fortunate in the fact that we have kind of a quasi-association network, and I work with the hospitals almost on a daily basis. But when I worked for the State Office of Rural Health in Illinois years and years ago, I had to reach out to these hospitals. I had to connect with them like a consortium. I had to, manage that process different. So you have to use different tools in different settings. But clearly you have to go through some kind of an education process with them once you find out what they need. Sometimes you simply talk to other SHIP coordinators. It's great when you have these networking calls that you can get an idea from another place. And I think as you move forward and looking at the needs, what did people use last year? What worked for the hospitals? Well, were they able to manage their projects? I think we've all had those situations where hospitals had a couple of good ideas and the project didn't work out, and we've had to retool the last minute and so forth like that. But there are several programs that the hospitals use that really have been great and beneficial for them. And so, are those that we can continue to look at that. And I think you want to really perk their interest in group projects. And I think you look at it if your participation rate in SHIP is going down each year, what is the reason? It's not clearly because they're joining systems, because many of your system hospitals participate in SHIP. It makes it a little bit more tenuous. They're not as needy as maybe an independent sometimes are. But nevertheless, it's not the only reason. Maybe our information to the hospitals aren't quite clear. So if we spend more time in that early needs assessment process and connecting in what we think might be good ideas, I think that makes a difference. And so, it's really becoming meaningful and providing those opportunities. And, we really want participation. You're going to hear this word over and over and over in the years to follow, is collaboration. And we're still pushing for that long-term hospital viability. We hear every day about hospital closures. And, this is an example of it. Maybe 10,000 doesn't seem much, but it's maybe helping, pull that money or individuals using it. That makes a difference to find that secret sauce to that program that helps turn the hospital around or gives them an extra jump start. And, most importantly, I think it's really up to us as the state SHIP coordinator to really generate ideas and suggestions. We have to help communicate the value of this program. Just sending out the application, just doesn't always do it. I've been guilty of that over the years past. I think, oh yes, this is SHIP coming up again, and hospitals remember. Well, once again, we talked about it last time, is that there's turnover. And we have to remember, just because I've been around the program for a long time doesn't necessarily mean the hospitals have. And so, I remember, when we first started, I kept thinking, well, gosh, why are these hospitals struggling? And finally one hospital said to me, CEO said, gosh, Pat, can't you just send me a list of ideas? And I said, oh, gosh, great idea. So, I really learned early on that list and that needs assessment process is so critical for the really growth and acceptance and program, the SHIP program. So, in doing that, if you're, like I said, not as fortunate as me as working with a network, if you're like I have been in the past working through the state office, is how do you find the hospital contact, reaching out to them. And those of you that, like Larry, I saw Larry was on the call, certainly know your hospitals very well. And if you don't have a network, you know them well enough, you can pick up the phone. But if you're new, like I was once new, I had to reach out to them. And so, you have to, if you're a state that has maybe only potentially 15 SHIP hospitals, you can reach out and talk to each one of them. If it's 85 SHIPs, you can reach out and, find out who it might be. And then when you put a working group together, you're going to pick maybe 8 to 10 people. But if you have 15, you can work with them as a whole group. Or if you're having to randomly select or getting just a few to make your kind of a work group, I provide a variety of them. Look for those that are independent, part of a system. Your innovators are. There's always somebody that in a hospital that's got an idea, and they're just looking for some grant money. And the struggling hospitals. So you want to make sure that you've reached out to all the hospitals, and whether you have the whole group or a small group, that's just fine. The advisory committee, like I said, I like to use that. I have an advisory group through our peer groups, and I set up a call and talk with them and find out what their needs are. And when you reach out earlier on, with the hospital, you can call the office, or if you know them, the CEO, who's going to be your SHIP contact, and you put that group together. I like to set up a group email, through your, we have listservs. I don't know if you have that capacity within your state. If you do, great. If not, you can always set up through your own email program is a group email and get them up. And when you pull these groups together, or just simply, they're the ones that's going to give you feedback, you've got that all pulled together. If you are going to have kind of an advisory committee, ask for if they would participate on 2 or 3 calls in the next few weeks. 10, 15 minutes each. Sometimes that's all it takes. But the thing is you're reaching out to them, you're getting them engaged, and you're really trying to find out what their needs are, so you can do a better job of laying out the ideas and options for them. So if you are going to put together an advisory committee, maybe you're lucky enough to get everybody to come in person, or you do a phone call or a webinar, whatever. And this is pretty typical. I don't think this is anything very exciting. I'm sure all of you can put something maybe a little more exciting together than this. But just if you're new to this, it gives you a framework. I think anytime you start a meeting, you obviously obviously introductions and you like to pull up something from each of the hospitals, have them share a little something about that. Because really it's about building relationships, and that's really critical to any program, is the building relationships. Explanation of the SHIP program, why is it important that they have $10,000 and explaining the categories and their opportunities to pull funds. And, and that you'll be doing a needs assessment. Either they can give it verbally, you can talk through it, or I'll show you a sample of a survey that you can do. Ask them, what resources are they working with, consultants that they like. Have they worked with a CPA firm that they really enjoy? Or, the hospitals are getting calls from healthcare consultants all the time, and a lot of them, they pass them on to me, and Pat say, we really like this, but I don't have any money. I think they do a great job of lean training or customer service or revenue cycle or whatever it might be, the ones programs that are of interest. And, they'll give you the ideas, or like I said, you can pick up the phone and call your SHIP state neighbor and say, hey, you got some new ideas. And there are times that I've partnered with other state SHIP programs, and, we can certainly do that too. No different than Flex. I think many of us have done group Flex programs. So, I mean, we're not limited, as particularly as the SHIP is expanded. And then you're going to explain to them about how the grant process works, the approval, they get the project, funds for the project, they have to complete it and so forth. But really, it's that outreach. Now, whether you need to have 2 or 3 calls, as was suggested, to continue to do that networking, that's really up to you. But this just gives you an idea. It's just getting started. But once again, it's about building relationships. How we ever do it, either through everybody on a call or a few groups or 2 or 3 people you reach out to, it's building that relationship. I know part of the discussion, when you're having an advisory committee or you're calling a few CEOs, seeing what their ideas might be, you really want to push out the pooling of funds. If we're looking at long-term projects and collaboration, that was one of the main intents of the SHIP program, because they knew 10,000 sometimes just doesn't go that very far. And so if you can combine it with, another 10,000 or 5 other thousand, 5 other states, and pretty soon you have $50,000. It certainly goes a long way. And you can, talk to, your systems, network and associations that work with the SHIP hospitals. They can help do that. And what you're wanting to do is get some ideas for programs and how we would manage that. So there is some discussion. You want to give them confidence if you're going to pull funds. If a hospital is going to say, I'm not going to use the funds, I'm going to partner with 2 or 3 other hospitals, and they're putting their SHIP money out there to go for that. And maybe you hire a consultant to manage it, or association, or ICANN like us, that we would do it. It's really the hospital's got confidence in you. And so when you pull the funds and you talk about it, you want to make sure that you can walk through the whole process so that they know that we're being good stewards with that money. As I said, if you get the group, we've done this for many years. We have several hospitals say, I really don't need the $10,000 for a specific project, but I'd like to partner with somebody. I've got an idea. I need a coding boot camp or something like that. I've used that example before. But what you do then is if you have 3 or 4 hospitals that want to pool their project, bring them together, set up a call with them and say, these are some of the ideas. How do we want to do that? Do you want to sign all your funds for this project or 2 or 3 projects? And I'll show you some examples. Do you have a consultant, or do you want you as a state office to do that, or does one of the hospital want to manage it? The SHIP is not defining that. The program allows you that flexibility. So, you can use the funds for it. You can offer scholarships, like if, let's say 4 hospitals pull their funds, it's enough to do a couple of educational programs, maybe on compliance or coding or whatever. And, all the people that would need to attend from those 4 hospitals would come to those programs free. But you open it up to the rest of the SHIP hospitals or other rural hospitals. Okay, will you allow them to attend, is there additional cost to that program that, they would pay a registration fee? Would you offer scholarships, for the other hospitals to attend? I mean, there's just lots of ways that you can put the program together. And as we move forward, we'll give you some examples. As the SHIP coordinator, a needs assessment, whether you're going to get involved with group projects or you're just simply going to help the individual hospital, find the project that best fits their needs. You've had an advisory discussion. Okay, you want to do a needs assessment. And I'll share this link. This is not a live link on the slide here, but I'll share that with Kate. But I put together a survey that's similar to what we've used in the past over the years. And just to give you an example, sometimes you can do a quick SurveyMonkey. Doesn't cost you anything, but rather some time. I mean, SurveyMonkey, most all of you probably have an account with that. And here's an example of what that might be. So, you can simply say, take a few minutes. I like to take the categories and break them down, like say what value-based quality improvement would be helpful to your hospital. Check your top 3 activities. You could say check your top 5 or 1 or whatever. But I made a list of things that I know that the hospitals have asked about. And so, you could probably do a program on every one of these things, but we only have so many dollars to go around, and you only have so much time. So what you want to do is begin to sort that out. And I've got an example in the survey for all those 3 category areas. I just showed you an example of this one of the value-based section. First, I did one for ACOs and one for PPS. And so when we share the live link, you could see that. Now, you could certainly tweak the survey, do whatever you want to with it, but at least it gives you an example of how you might be able to do it. Very simple, very easy. And, the time is now as we're having to do this competitive grant program coming up in September and October. This is your time to reach out. Let's step back for a minute and think about, a situation. Okay, let's say you're a state and you have 35 eligible SHIP hospitals, and 29 are critical access, 6 PPS, hopefully my math is good here, 20 are independent, 15 are part of systems. Your participation, it went down to just 26 out of the 35. more than 15 of your hospitals are financially distressed according to the Advantage. There's some ACO activity going on. There's new regulations coming out. So how do I jumpstart SHIP, and how do I kind of target hospital needs and best use of SHIP dollars? Does anybody want to chime in on that? Kate, anybody want to chat and give me some examples?
Yeah, remember, press *2 to unmute your line, or if you have a comment for Pat on this, you can also use the chat box on there.
Do you want to take a stab at it? If not, that's okay too. Any takers? Okay. Well, this is just an example, and I don't know whether it fits you. Like I said, some of you are very experienced at doing this and maybe just looking for a couple of ideas. But those that are new, it might be helpful. So this is, my impression. I thought, well, if I'm having to deal with this situation, I'd start with connecting with the hospitals, setting up an advisory, doing a survey, finding out who are my go-to people. And, if I did the survey, getting a list of, putting together a list of potential programs and so forth. And I want to do an outreach letter, and then maybe a webinar. I want to talk about the individual option. If they don't want to, particularly if your participation has gone down, over the years, and that's common. It happens in Illinois too. We have hospitals coming and going. Different CEOs or different grant people, and part of that is our responsibility for the re-education process. But anyway, I'd reach out, offer a webinar, propose some types of group projects, give them an example of who would coordinate it. If you're in a state where you've got an association or a consultant that you're working a lot with, maybe there's an ACO. Many people are part of different ACOs. I'd talk to them, find out what they might be interested in. Clearly, if you go back, to the slide and you look at it, you have 35. That's $350,000 that you can technically bring into your state that could help these hospitals. There's clearly some opportunities for credentialing if there's new regulations. If there's some ACO, there's obviously the hospitals need support to participate. They have to work on care coordination. You've got some in the systems. Surely the systems could use some help with that. But anyway, it clearly becomes outreach. And, I guess I would set myself a goal. Gosh, if I only had 26, let me see if I can get up to 30 this year by offering, a little bit more to the hospitals and doing that. So here's an example. And I've done this for years, and like I said, it really started early on years ago when one hospital said, well, Pat, this is a wonderful SHIP idea, but give me some more ideas. Don't just give me one. Don't just tell me money is available. And I've got 3 categories to select. Help me out. And so this is just an example. There's a third part to the letter, but it's a letter out to the hospitals and saying, here's once again a reminder about the SHIP program and eligibility. And you may be doing this already. If you are, you can look at mine and see whether that is helpful to you or not, or if you're new. And then it gives you some ideas. I remind them of first, second, and third priority, and then I said, here's some options. And there's a third part to the letter and some other stuff and follow-up, and that there'll be a training period and a training webinar and a time that they have to submit this and so forth. But, clearly I have to give them guidance. I can't just put it out there as I did years and years ago. Then we would, logically set up a webinar, reaching out to those hospital contacts. Whether you set them up as an advisory committee or you simply, they're your contacts for sending out the SHIP information. I find sometimes when I send out stuff for SHIP, it goes, I like to know who the contact, because, logically you send it to the CEO. Sometimes CEOs say, hey, I'm not worried about that. Would you please, send it to the quality director? And so, when you're back there looking for your state contact, you do call the admin office, but find out if that person in the admin office is going to be your contact or the other one. And then when you send the guidance out, make sure it gets to both the CEO and the contact person. Likewise with the webinar. You can see that Holly and Lindsay within my staff last year, they did a webinar on, what were the options, how is it going to work, and so forth. And so, you set up a webinar, and like I said, those really have no cost, the things that you can do through WebEx or, whatever the process is. Okay, let's say, you've done all of this, and several of the hospitals get back to you, they fill out and they say, we want to pool our money. So how do you decide, what to do with that? And how do you determine, the best project for you to use? Best program or project that you want to move forward with this. And here's an example. We had, this is to give you an example here. The first one on this, the sheet on the left is really, it's a blank form. It's a form, and I'll share that with you, that the hospital can fill out when they're doing their SHIP program, that they want to pull their funds. And we give them categories, and they'll simply list down, and they'll make and you'll see in some of the other ones that they identify, we want to give money towards value-based purchasing. We know you're going to do a program on X, Y, and Z. And so when we're collecting that information, I'm already getting an idea of how we're going to have to develop the pool. So here's 3 hospitals that said, hey, in our conversation, we want to pull our funds. And in doing that, we want to do a 3-day on-site Medicare boot camp. And here's an example. They put it together, and those boot camps are about, $25,000 or more. I mean, it doesn't take long to spend money doing those, because there's several days, and you have to set up, transportation for these people getting there, and so forth. And so that's what they wanted to do, and we put that out there, and they were all able to participate freely, and then we opened it up to others, and because there was some additional cost, there was a small registration fee, and I think we had 50, 60 or 70, a good group attending, the boot camp, so it was really well received. But that's an example, but you need some kind of a process for these hospitals. If they want to pull their money, how are they going to do it? How would you look at doing that? And then you, if they're going to do that, you need who you're going to call at that hospital and work through the process, So, like I said before, the options, how are they going to do it? And the funds to cover the projects, will they divide it up among the projects? Among those that are participating in it, the money, they do top 3, what money is left, we do the top one. If there's any money left, maybe you do second and third project. You can offer scholarships or reduced rate for people that aren't pooling their funds. And sometimes we have hospitals that just simply, 2 or 3 hospitals, they want to work on lean training together, and they're just going to do it themselves. They have the right to just take their money or have their consultant pay for all their inside training, programs and things like that. They don't have to share that with the rest of the group. In Illinois, for the most part, we've had everybody wanting to share. If they've had that experience that they've been able to pull their funds, they're willing to share that with others. So here's another example, and I'm sorry you can't see this well enough, and I can send you the examples of this, but here's Massac and Abraham Lincoln. Once again, that they wanted to pull their funds for a rural health clinic, for doing some quality. They wanted to participate in the pond project through NOSOR that you're familiar with it. They're going to pull their funds so they can participate and allow several others. But you can see that they go through it. They have to do their decision tree. They have to put their objectives in. So we know that the funds are going to be used correctly, whether we're spearheading the project as ICANN or the hospitals or a consultant. Okay, like I said, here's another example that was kind of part of the other one, but here's one that wanted to do some money towards HCAHPS training or MIPS training, and they wanted to hire a consultant to do money towards that, and they identified that $6,000 would go to X and $3,000 would that. So if we're coordinating that, ICANN or you, the project manager within SHIP or a consultant, the hospital then tells you how they believe those funds should be spent. Now, you can always go back and forth with them and work on that. If one project costs more than the others, but at least it gives you a start. So part of that initial, once you're doing your needs assessment, you're sending the hospital application out, you've done all the communication about how to fill out the forms and the project options. We include this shared program listing so that if they do want to form a consortium, that they do want to pool, that this is an example. So this is, once again, I think you can see this a little bit better, and I put this in a third example because you can see it better. The other one I mapped out a lot more. But anyway, with this, I guess this is the second year we've done it, but with this training agreement is an example of, what we had to then move forward and put together a training group. We worked with HC Pro, and they set up the meeting. And this is just an example of what the contract would look like. Here's the fourth example. A hospital wanted to do a program on care coordination and performance-based. They wanted to bring somebody in to do some physician training and so forth. And so we had to set up several webinars and on-site meetings and so forth. But they particularly wanted it on, we have about 24 hospitals in our ACO, and some of them, we've got several that are in other ACOs, that they wanted some additional help with their population health part and their care coordination. And so they said, well, let's pull our funds limit. My hospital is not going to use it. I don't have a grant coordinator in the hospital, and I want to use the funds for this ACO, and I want to share it with the other ACO folks. And it was really very helpful. It covered some costs that other hospitals didn't have to do, and it really was a way of generating new ideas and new programs for them. Here's another example. This is one that we're working on for this year. Here's an example. We have I don't have the original one, but we have several hospitals that wanted to do a crisis intervention and prevention workshop. This is one of these national programs. It's very expensive to do train the trainer. It's thousands of dollars, and a hospital itself can't do it. And they agreed to work with ICANN and do some train-to-train at the Christ CPI Institute. And so we've got 2 regional training programs set up. The hospitals pulled their funds. They have some extra funds, so they put out a scholarship program for those that can't really afford to pay the full price if they're going to participate. But that's another way of how you can share the funds, others can take advantage of it, and you really benefit overall with that. And that's really collaboration. Several hospitals that have an idea, they have an own personal need, and then they actually, the particular hospital that's driving it, Pinckneyville, their CFO really wanted to bring this to their hospital. When she explored it, it was just too expensive. She called us and we said, well, we know we have the SHIP program coming up. And she went around and sent a note to all her counterparts in other hospitals and said, would you be willing to participate if we did some pooling and so forth? And we had an overwhelming response for that. So just as an example of how you can be creative with that program. And last, here's another one, and I highlighted it. I don't know if it's any better to reading or not. Sometimes it's hard to make, to take samples and put it in a slide here. But what I wanted to show you, this is when we're working on sepsis protocol. We have a hospital, Rochelle, wanted to participate in the SHIP program, didn't know quite what they needed themselves personally, other than they needed help with sepsis. And they felt that they could benefit from working with others in the project, and so they're sharing their funds. But you can clearly see that there's a decision tree, there's objectives, there's time frames for that, and so that there's a responsibility for through the whole group project. And so it's easy for us then to follow up and do our reporting through the SHIP program as the coordinator. So, you could be creative, and sepsis is a new focus for us, and this is a way that you can not only help that particular hospital, but that other hospital then collaborates with other SHIP hospitals and shares that experience. And so I think that's a real good example. So let's say, we'll see if we get any takers on this, but let's say you have 5 SHIP hospitals and they want to pull their funds, and together that's $50,000, and they want to focus on 2 areas. Revenue cycle program, they're all cash strapped or whatever, and population health, there's an interest in doing a care coordination program or a navigator training program for surgical services, something like that. But anyway, here's, so how would you advise? You get this form filled out and said, we want to do this. So if you're the SHIP coordinator, would you work with it yourself? Do you have the capacity within your own state office of organizing this program for these hospitals? Or do you help one hospital take the lead and become the lead in this project and help them set up agreements with the other hospitals? Or do you work with an association or a consultant? So there's a variety of ways that you as a SHIP coordinator, doesn't mean that you have to do that, but you have hospitals to do that. But since you're the coordinator and you're putting the state application, and if you have hospitals that want to pull their funds, you have to have a ways and means of finding a solution for that. You don't have to take it on yourself, but can you find somebody else that can do it? Like in our situation, often is I can. Sometimes we reach out to consultants. There's no way I can do a coding boot camp for rural health clinics, or ICD, the new coding thing that came out. There's no way. I don't have those skill sets. No way can I do sepsis training. But I certainly know consultants that I can call, or hospital programs that have done it that you can reimburse their travel time. There's a variety of ways if you could do it. And if you don't have the staff time and you need somebody to do the research, then, there are different organizations. Maybe your hospital association already has something in place that you give them a call. But that becomes part of your grant application. You have, if you're going to offer group projects, how are they going to do it, and how are you going to help support them through the process, either individually as the state office, through an association or network, or the hospital itself taking the lead, and so forth. And maybe there's another scenario out there that I don't know. But anyway, that gives you an idea of how you have to think about it, and as you're putting the application together. And just in, some closing comments, as we move through this discussion, it's the group project, and I think that's probably the most challenging to us at the time, particularly if you're new in the office and you don't know the hospitals very well. You don't have a lot of experience pulling them together. I had to learn. I had to learn to do that years ago, and it took me time. I had to build relationships with the hospitals. I had to do programs. Some failed, and some were very good. But, if you move forward with our new group project, longer time frames is something we hadn't really considered. And so I was thinking about that, how do we best plan for this, and how do we look at it? And I think pilots are really good, are good for that. Programs. Let's say there's several hospitals that want to try a new protocol out, or an example of this is, let's say you wanted to try out an app for customer service or something like that. You could do that, and because you want to study it over a period of time. And like, again, a lot of your consultants, the Brian Lee's or Studer or Joe Tai, there's hundreds more that, when they do their customer service, it's not a one day or even 6 months or a year. They're often 3 years, and this allows you to build this. And you may have hospitals, start the whole 3 years and go through that process, or maybe you allow them to come in and out of it. But, most of the time you're going to have to, if they're going to be a 3-year project, you're going to have to get them committed for 3 years. It's going to be real hard for people to go in and out. You might have one person do that, but but realistic customer training isn't just, as I said, one day or over 6 months. It's several years. ACO projects, we have an ACO in Illinois, and I can tell you it takes a long time to turn the ship. It's like, steering the Titanic. It's a long time to change healthcare behaviors, and not that people don't want to do it. It's day-to-day life, and so you can practice on that. One of the projects we've been doing, but this isn't can easily be applied to SHIP, is we've looked at discharge planning instructions from our emergency department. That's going to take a while to develop. You're going to develop some discharge instructions and then trial it, and then put it in action, the following year, and then maybe you have to retweak it, and then, so forth. So this gives you a chance to really further develop a program. Instead of 10,000 one year for one thing, you actually have 30,000 over the course of 3 years to develop a program if a hospital does it individually. If they pool their funds, then you have more funds over a greater period of time. The trainer role is great. Let's say you want to create a credentialing program, sepsis protocol. Like I said, we've got that one rolling out thanks to Rochelle. But I guess rollout's not right there, but you know, when you're looking at that, you know, sometimes it just doesn't happen in 1 year. So this really gives you a chance. Let's say a practice management course or certification program on compliance. That's one thing that people need to study for. You know, helping them the education and training, and then, you know, training the following year. Also developing a compliance manual. You know, if they go through the training, maybe you continue the following year in developing a compliance manual. And, you know, so that might be a 2-year project. I mean, that would be very, very valuable. You know, if you look at programs that would help relieve the burden of the hospitals that have limited resources. Or, you know, simply maybe if a group of people want to develop a rural patient safety organization. As I said, the last thing we're seeing, your workman's comp and professional liability companies saying that they'll give a reduced rate to hospitals if they're participating in a patient safety organization. Well, there are not that many around. And so maybe that's a way that they can do that. It will be a challenge for you as a state officer, or, you know, for the SHIP program, or a challenge for if one of the hospitals decides to be the project manager, you know, following that project all the way through. You know, the SHIP guidance will be for several years, so obviously they'll probably set aside for that. But, you know, be thinking about that when you're talking with the hospitals, thinking about the types of programs that could go over a period of time and how that might work. So when you do your needs assessment, you know, maybe you carve out a spot for, you know, projects that, you know, might be for several years, and explain what that might be. So let me, before we finish here, I wanted to talk a little bit about participation strategies. And, you know, that was from the original case study. You know, hospitals, you know, they don't want to participate, or they say they're going to participate, and they get to the end of the period and they haven't spent their money, and, you know, and so forth like that. And it's a struggle for the SHIP coordinator and state offices. But back to the participation here, I'm just going to talk initially about that. It's really about good communication. You know, starting from the beginning, you know, connecting in with the hospital, building that relationship, finding out who your SHIP coordinator is, doing an advisory call or not, you know, or if you've got a group already in place,